And
good afternoon, everyone, and welcome to our Wellness Kitchen episode. We are so excited to have the cardiopulmonary rehabilitation service department with us, and they have an awesome cookout menu for you today. So we have Jennifer Peterson here, and she is the cardiac and specialty services manager. We have Kelli Winchell, who's the manager of respiratory care services. And you want to introduce your friend?
Yes. This is my longtime friend, Mary Beth Lacey. She's going to be helping us cook today.
So we are going to go ahead and get started. We have, like I said, a wonderful menu. The recipes will be on the link, so you can watch those. But we're going to go ahead and get started. Do you want to go over what the menu is first, and then you can go ahead and get started cooking?
Sure. So today we're going to be making a spinach and feta turkey burger with a caprese pepperoni skewer, and then melon with vanilla bean syrup.
Okay, so let's go ahead and get. What would you like to get started on first?
I think we'll chop the spinach up first.
Okay. So we're gonna get started on the burgers.
Yeah. So let me squeeze over here. So we have our ground turkey, and she's chopping up our fresh spinach. We're gonna add some fresh feta, basically to your liking, about a cup and a half.
And while you're cutting that up, can you tell us like what some of the services are that you offer?
Cardiopulmonary services, we take care of patients that recently had a heart or lung issue. Many of the cardiac patients have had some type of bypass surgery or transplant even. And then for the lung patients, they have COPD or have other respiratory issues that makes it difficult for them to function properly. So our goal is to improve their heart and lung function through exercise and other means of support and education.
All right, how are we doing on this spinach
We are
here?
doing good.
So we're
I
chopping
think
up
we're
the
about
spinach.
ready to add it to our turkey.
So you just get ground turkey. We got this up before. Yeah.
All of this?
Mm-hmm.
Yeah. Okay. Some salt and pepper. Some salt and pepper on there. Just some salt and pepper to taste.
So how long have you worked at ACMC?
I've been with ACMC for 10 years as an employee, 12 if you include when I was a student. I was a student in X-ray for 2 years, and then I started in the cath lab as a tech, and I became a coordinator in 2019, and now I'm a manager.
Awesome. And Kelli, how long have you been?
And I have been with ACMC just over 5.5 years. I was, came here as the manager of respiratory, and prior to that, I was a staff therapist at the Cleveland Clinic.
So we talked a little bit yesterday when we were planning the day about some services that you have for COVID patients and long haul COVID. Can you talk a little bit about that?
Yes. Now CMS and other insurance companies will cover post-COVID as a diagnosis for pulmonary program. So as long as if you have any lung issues after having COVID about a month ago or so, then you could qualify. You should talk to your doctor and see if they can get you ordered for it.
So do you need to have like a doctor referral? Or?
You do have to have a doctor order it.
Okay.
And then when that happens, my staff would call the patient and set up a schedule. You would come either 2 or 3 days a week for about 12 to 14 weeks. We do about 36 sessions, and then we check your improvement.
Awesome. So it looks like they have the turkey burgers. We have a little portable grill, so you can do that outside if you want. If you're doing something for 4th of July, you want to have a healthy menu, you could do that outside, or you could do it inside like we're doing here. So how long does minutes do you cook the turkey burger?
8 minutes. 8 minutes on each side.
Okay, all right, so we gotta find something to do for 8 minutes. Okay,
Yes.
let's see. All right, so what's next on the menu?
So next
What are we gonna get started on?
We'll get started with the sauce that we're going to put on top of the turkey burger.
Okay,
The ziti sauce.
so what do we have here in the sauce?
All right, so this,
So we have just a Greek yogurt. I'm sorry.
yes, this is 1.5 cups of Greek yogurt. And 2 garlic cloves are optional. We are not adding them today. 2 tablespoons of extra virgin olive oil. 1 tablespoon of white balsamic vinegar. And half a teaspoon of salt. And a tablespoon of fresh dill.
And again, the recipes will be on the link, so you can just simply click on that and print them out.
Put some on top of that. Get a spoon. Sorry.
That's really good. I've always wondered how to make tzatziki sauce.
Cucumber.
Putting the cucumber in, so you just add it all into one bowl and just kind of mix
And
it.
just kind of mix it up. Yeah, let's get salt.
Salt, pepper to taste. The turkey burger smells so good cooking right now.
I'm going to put a little bit of olive oil in there, and then we can drizzle a little bit on top too.
So then you cook the turkey burger, and then this would go on like last, like as a condiment dressing.
Yeah, that's a
type thing?
condiment.
Okay.
Yeah, so it's just all mixed together.
Oh, it smells so good. So as far as patients, like, what do you recommend as far as a healthy diet for your patients?
It
Obviously,
definitely
that
varies
helps, right?
depending on, their illness, but we do push, lower carb and lower fat and
Okay.
but every time a patient comes in, the nurse that works there will go over their specific needs and their specific diets.
Okay.
It's an individualized treatment plan. Every person has their own exercise regimen, their own
Okay.
diet plan, their own everything.
That's good
yeah.
to know. So then they definitely should exercise. It's just
Yes.
they need to have help from
Yes. Yeah.
from your
Right.
department.
We
to-
provide lots of education. We have a nutrition class every month. So every
Okay.
month, patients come in and they hang out with our nutritionist for about an hour, and they go over any questions that they might have about their diet and nutrition. We have a tobacco cessation program, so we
Oh,
promote
wonderful.
no smoking, of course.
Very good.
I think that's about it. And then the exercise, of course.
Okay.
And they spend anywhere between 30 minutes to about an hour
Wow.
with
okay.
us.
Good.
Yeah, every other day or
So
so.
they get a full-rounded.
Right, they do.
Program,
They do.
so that's
It's a
good
very
to
good
know.
program.
And then you're located again. You're in the hospital.
We're in the hospital near the old main entrance.
Okay.
So you'd have to go into the new main entrance and make like a big U around over to the cardiac side of the hospital.
Great. Okay. So how are we doing? What are we working on now?
So we can put the skewers together.
Okay.
So for the skewers, you're going to need cherry tomatoes, just some deli pepperoni, mozzarella. If you can find larger size balls, that's great. If not, you can cut up pieces of mozzarella. So we'll do that part first, and then we'll talk about the dressing that goes over top of them. So let's see. We have our mozzarella. We'll just put a couple pieces on there. Cherry tomato. And have these kind of ready. And then just repeat the process again.
And then I'm assuming like if you like any other kind of veggies, you could add whatever you wanted.
Absolutely.
Or if you don't like pepperoni, you can put
Salami or
salami
ham or turkey.
So then we'll just make up a few of those.
How's the turkey burger coming? It's not burning, is it? Oh, it's good.
That's good.
It smells good.
It smells really good.
You're doing a great job, Kelly.
Yes. Good job. Well, thank you. You can help. Why don't you help her?
Well,
Here.
you know, my palms are kind of
That's
sweaty.
All right.
Kelli and I collaborate with the cardiopulmonary program. Since she's respiratory services, what her department will provide, they'll do a PFT test, which is
Okay.
a pulmonary function test. They'll do that before the patient comes in. And then we do the program. And then at the end of the program, they get a second pulmonary function test. And that'll show us if they made any improvements or not.
And how many patients do you think you see a day?
Well, we can only service 25 per day because
Okay.
of social distancing guidelines. We can only have 5 patients in the gym per hour. So after it's all said and done, we get about 25 patients total between cardiac and pulmonary.
And then once they finish their therapy, do you then refer them to the physical therapy department?
Typically, they
Next
come
year?
back to us to what's called phase 3. Phase
Okay.
2 is the structured program that provides all the additional education, the one-on-one counseling, things like that. The phase 3 program is just like an exercise program. They can come in, do their normal routine, and then there's just medical personnel nearby if they need it.
Great.
So we've put a few skewers together. So we're gonna make the sauce that goes on the skewers. It's more of like a vinaigrette. So we do have a mason jar here that's just kind of easier to mix it, shake it up a little bit. And we have here,
Extra-Virgin Olive Oil.
that's a third of a cup of extra virgin olive oil. 1 tablespoon of the white balsamic vinegar. A 1/4 teaspoon of garlic powder is optional. 6 basil leaves cut up and minced. And then a pinch of salt and pepper. So then you just make sure the lid's on.
So then if you don't use all of it, are you able to save that in the fridge for a little bit, or how
Yeah,
does
you
that
can use it even on a salad. It would be
work? Awesome, okay.
Okay. So that's all mixed up.
Beautiful.
And let's see, spoon. So then we'll just spoon it over. Like so.
Oh, that looks wonderful.
It just gives you that little bit of that basil to go along with that. Just like that.
Great.
All right. So did we flip our burger yet?
We did.
We did.
Flip the burger.
Okay.
Only got a few more minutes.
So,
We could make the sauce for the
yes. For sure. So, for a healthy, treat at the end, we have some melon here cut up, cantaloupe and honeydew, and we're gonna make a little sauce to go over top of that. That is gonna be 2/3 of a cup of sugar, 1/3 a cup of water, 1/3 a cup of lime juice, and then some lime zest.
And then if you, say you're on a restricted diet, maybe you don't want to use sugar, you can use some sugar substitutes as well. And then it's really hard, like when you're 4th of July or cookouts, it's so hard to eat healthy, because you have all that junk food, you have potato salad and chips and all these things. So this is just a great way to have something healthy, but also, it's still sweet, it's all fresh. So you'd be surprised how good this does taste. So definitely, try in your menus this summer, try to use some more, healthy type ingredients.
And then we're gonna put in 1 vanilla bean split.
Now, if you can't find a vanilla bean, what are some, could you just use vanilla, or what are some options?
Good. The vanilla would flavor it.
Okay.
Yeah.
So this gives it a lot more flavor.
Yeah, the vanilla bean steeps in there and it makes it really nice. But yeah, you could use regular vanilla too.
That smells so good.
It does.
I
can
love
smell
wine.
Lime
Yeah.
and vanilla go all together.
Yeah, that smells really great.
Just keep that on the heat until the sugar dissolves and then let it cool completely before you put it over your melon.
So is there anything else you want to talk about, your departments or services that you have?
Just make sure you talk to your doctor if you want to get started into a program, if you think you might qualify. Talk to your doctor so they can get an order in. My staff will reach out to you and get you scheduled and put on the list if we have one. And we hope to see you.
Yes.
We want
So
to be
if
there
they
to help
want
everyone.
to reach you, how do they call a certain number?
Yes,
or-
Cardiac Rehab, they have their own line. It's 440-997-6649. So you would give them a call if you have any specific questions for cardiac rehab or pulmonary rehab.
And if you had any questions about the pre or post pulmonary function testing, the number to our department is 440-997-6696.
So have you seen a lot of increase in people with the long COVID symptoms?
We have for sure seen that.
So still now there's a little bit.
Yes.
I'm anticipating it getting a little bit more frequent now that the word's getting out there and everything else. We already have two or three people that are post-COVID that are enjoying the program and are already starting to feel a little bit better. So if you feel like you have stuff hanging on from when you had COVID and it's been greater than a month, talk to your doctor and see if you can get into pulmonary rehab.
So how long do you cook the syrup?
Just till the sugar melts.
Okay.
Yeah, just till the sugar melts and then you can set it aside, let it cool completely before you put it over your melon.
Will it thicken or will it stay thin?
It
like that?
thickens a little bit.
Okay.
Yeah, it does thicken a little bit. And then if you can top that with some fresh whipped cream, and you could even put some lime zest on top of that too, give it a little bit of color.
How are we doing on the turkey burger?
There, it looks great.
All right. Well, while that's cooking, should we just go ahead and put together the burger?
In the way.
All right. So we are just going to show you what everything is going to look like when you're all done.
So this, the sauce that you made, the tzatziki sauce, here on your burger. And
Oh, that looks so
skewers.
good.
It really does. That looks like a great lunch.
And let's see, some of the melon. Let's get us sauce.
Here's some whipped cream for you.
Some whipped cream. Very good.
Okay. So, as far as the medical part, what if someone doesn't have a primary care provider and they want to make an appointment with you? We have several that they can choose from.
Right, absolutely. And the order can come from any physician. It doesn't have to be a cardiologist or a pulmonary doctor, or
Perfect.
it does not specify. It can be any doctor.
Okay. So the other thing I wanted to mention, because I think I forgot to mention earlier, we want to make sure that you like and share this, because if you do, we're going to pick a winner, and you'll get a $25 gift card. So We did pick the winner from last time. When we had the Wellness Kitchen with Dr. Sam, we did pull a winner, so we're going to announce that now. And her name is, and if I mispronounce your name, I'm sorry, but it's Nancy Petiti, I think. So she is going to be getting a $25 gift card. So if you want a chance to win, all you have to do is like and share. And then on our next episode, we will reveal the winner for that. All right, so this is the final product. Someone has to be the taste tester who's gonna do it.
We could. So.
I had a feeling. I'll definitely try this burger.
That looks so
That looks
good.
amazing. I love turkey burgers. That's like my favorite. And then to have it not just plain would be great.
It looks so pretty.
Oh, it's gonna be interesting.
All right.
It's gonna be messy too. Just a little bit of vanilla syrup on the bottom. It's
Yeah,
okay.
that'll
It
be
all
good.
goes in the same spot. Oh wow, that's really good. I need to make a copy of that.
Right. So I want to thank you so much for doing this Wellness Kitchen episode. If you do, again, would like to make an appointment with Jennifer or Kelly's department, can you again tell them how they can reach you?
You can reach me at 440-997-6601 if you have any specific questions that I can answer. If you need to touch base with cardiac or pulmonary rehab, the number there is 440-997-6649.
And the number for the respiratory department and the pulmonary function lab is 440-997-6696. And I would like to thank Mary Beth for joining us and cooking with us today. It was a lot
Yes,
of
thank
fun.
you. Otherwise, they would have caught me burning myself, I'm sure.
Okay, well, stay tuned for our next Wellness Kitchen. We will post who that will be shortly. But again, like and share and have a chance to win that $25 gift card. And thank you again, everyone, for participating.
Yes, thank you for having us.
Yes, thank you.